Hello, this is Norman. It's March 8th, 2021. Um, do have some notes back here. I decided to discuss the disease state of benign prostatic hyperplasia, more commonly referred to as BPH. It is defined as a non-cancerous enlargement of the prostate, causing various urinary symptoms. More specifically, it would be an increase in the number of cells within the prostate gland, which is why we have the term hyperplasia within the name. I have seen some sources that have called it benign prostatic hypertrophy. Sounds similar, but I don't think that that's quite as accurate. As far as how it's classified as a male genitourinary disease, and it would be under the syndrome of urinary obstructive syndrome. As for etiology, the exact etiology is not known, but it is thought to be related to circulating androgens in the body, specifically testosterone and its metabolites, the main metabolite being DHT, or dihydrotestosterone. Basically, the androgens will circulate to the prostate, where they will stimulate the proliferation of prostate gland cells, and causing enlargement of the prostate itself and leading to symptoms of obstruction. Other etiologies, there is thought that there are some dietary factors that come into play for the cause of BPH. It's not definitive that diet factors into it, but there have been some studies that there seems to be a link between high protein diets and developing BPH. As far as signs and symptoms, you'll have, if you think about how the pathophysiology of it, you've got obstruction of the urethra, so you're slowing down or preventing urination. So you'll have, incomplete emptying of the bladder, difficulty urinating. So some men will really have to strain hard to initiate urination. Urinary frequency, nocturia, or waking up frequently at night to urinate, can lead down the road to urinary incontinence, and I think that's about it. Could have, a weak stream, or another one was urinary, what was that? Intermittency, urinary intermittency, where it's a pretty common symptom, where men will start urinating and then stop, and then start again, and then stop. So those are the symptoms. As far as diagnosis, basically it's diagnosed on patient's symptoms. So the provider will ask, usually the patient will bring up the fact that they're urinating a lot and having to wake up a lot at night. That could be caused by diuretics or things like that, but if it is BPH, the provider's just got to look at the patient's history as the main factor in diagnosis, but they also can do a digital rectal exam, or DRE, so they can physically palpate the prostate and see if it's enlarged or not. You can also have the patient fill out it's a AUASS, so the American Urology Association symptom score. So it's just a questionnaire that patients can fill out, and it'll tell you how severe their symptoms are with BPH. So that can be a useful tool in diagnosis. And also PSA, you can check their prostate-specific antigen level. If the PSA is elevated, it will indicate that there's something going on with the prostate. It certainly doesn't definitively tell you that the patient has BPH, but Usually that elevated PSA will be associated with either BPH or possibly prostate cancer or inflammation of the prostate or some type of infection. One differential diagnosis would be urethral stones. So if a patient comes in and has urethral stones, they're going to present with various similar symptoms as BPH. And lastly, some complications. So if you do get to the point where there's complete urinary obstruction, that's a pretty urgent matter or urgent complication. And also, if you look at kind of what's happening within the bladder, you have incomplete emptying, so you've got pooling of urine within the bladder that will increase the risk of infection. So UTI would be a complication. And along the same lines with the incomplete emptying of the bladder, you can just cause bladder damage, or with the fluid backup, it can cause kidney damage as well, and possibly increase risk of prostate cancer. And I think that's pretty much it.